Is the voice okay now?
Yes, yes, sir. A very good evening to one and all. I'm delighted to welcome all to this today's webinar on behalf of the ITCP group. My name is Arpita, and it's an honor for me to be a moderator for this very important session on the topic controversies and challenges in vaccination. Now, I would just like to give a brief to all of you regarding the topic. Vaccination has been one of the most effective public health interventions, yet it remains a topic considerable weight and scrutiny. This webinar will explore the current controversies and challenges facing vaccination problems globally, including vaccine hesitancy, misinformation, and evolving scientific and regulatory misconceptions. Our expert panel will review the historic context of the vaccine controversies, discuss the impact of social media on public perception, and examine the ethical, legal, and logistic barriers to achieving widespread vaccination coverage. It's an honor for me to welcome our speaker and expert for today. We are fortunate to have with us today Dr. T. N. Ravishankar, sir, a distinguished family physician from Sudha Hospital, Chennai. With his very extensive qualification, sir is MBBS, DFM from Colombo. He has done FCGP, PG, DMLE, and an MBA. Sir brings vast clinical expertise and he understands the challenges surrounding vaccination in modern healthcare. Vaccination has always been a cornerstone of public health, yet it continues to spark debate and challenges in today's landscape. So, with this very brief introduction of Sir and of the session, I would now request Sir to please take over the session from me. Over to you, Sir.
Good afternoon, and thank you for the nice introduction and the controversial topic that you had given to us today to try to give an insight of the challenges that we face as a medical practitioner in this vast country. The country is known for everything, including the non-communicable disease. There were times when lots of communicable disease in this country where we had difficulty in changing the scenario. And in fact, our country here, it was called a developing country, but now today it is a developed country, both financially and on the health sector also. When the country got independence, the average lifespan was somewhere around 50, and now it has gone up to 70, which shows that the health sector in this country has been doing the best for it. And we need to thank the authorities, the scientists, the doctors who have been serving this country to improve the lifespan. And improving the lifespan, there are lots of things that involved. And let's see how vaccination has taken forward. And let's see what's vaccination initially, just to understand why there had been controversies and challenges. Vaccine is something which produces immunity for an infectious disease or against a pathogen. Well known to everybody. The process of introducing a vaccine into the body to develop immunity to a disease without getting infected. It was first happened by Edward Jenner in 1796 when smallpox was rampant all over the world, be it a developed or a developing country. But then Edward Jenner found that the milkmaids who were milking the cows which had pox, and these milkmaids who had been milking the cow never suffered from smallpox. This stimulated his brain to try to use the antigen from the wound of the cow which had the pox. And he gave it to one of the small kid of 8 years old. It's called Philip. And he gave that antigen to him and exposed him to smallpox. This guy did not got infected with the pox. And that was the first vaccine that was discovered in the country, and that paved way for a public health initiative. Infectious disease was an alarming one in the world, and when penicillin was discovered during the World War, it gave a big miracle of the wounded soldiers from recovery. And when wounded soldiers recovered from the antibiotic, vaccination, and Edward Jenner's discovery help the community, the world, all over the world, to come out of certain infectious disease because of the health initiative that took over the governments ruling them. What is the status of the Indian kids from immunization? Let's look at it. The National Family Health Survey 5 in 2019-21, the country's full immunization coverage stands at 76.1%, which means that 1 out of 4 children had not been immunized. Had it been 1 out of 40 children, the success of the government would have been reflected so well that people will not be suffering from infectious disease. But Health Management Information System portal gives that coverage to stands at 89% in 21-22, a year later. But anyhow, compared to the developing countries, South African nations, South American, India stands much higher in immunization status and the quality of the population that are there. To see how many diseases could be vaccinated and prevented from suffering, there are 26 diseases that have vaccination as per the WHO. Plague, leprosy, smallpox is almost eradicated. Leprosy to an extent, though of course there had been a new vaccine in 1998, but they still keep using the BCG, which has got a dual vaccination power to treat both tuberculosis as well as preventing leprosy from affecting. And the 6-in-1, diphtheria, polio, tetanus, pertussis, Hib, and hepatitis are the major one which has been kept on conquering in the developing countries, and that's a big sign. And in fact, India is one country which has eradicated polio. And if you consider vaccination, the myth, the controversies, and challenges, rabies is one which can be set an example. Today, a population, if they have a street dog bitten, they are there in front of the family physician or in front of the government hospitals to receive a vaccination. Once upon a time, it was 16 injection around the umbilicus, and growth of science has now to come to the stage of 5 injections at varying intervals. The standard protocols of intervals that has been there. Today, any person who has a dog at his home are supposed to vaccinate the dog. And if that vaccination is there, in spite of that, if somebody is being bitten at home, they do need to take the rabies vaccine. And the population is aware that once you are bitten by a dog and you suffer from rabies, it's impossible to survive. And there are only 3 people in the history who have survived after a rabies dog bite. And today, people are aware that rabies is one which cannot be conquered. It has to be prevented from a person to get to be infected. Unless it is prevented, there is no chance of survival after once you get rabies bitten by a dog or by a bat or by a cat or by a monkey. This is well known to the population. But what is it that the controversies and challenges that it has crossed? We'll see it a little later when we are trying to talk about that thing. Zero dose in India. A child not receiving even a single vaccination is called a zero dose. At birth, in any hospital, definitely a oral polio, definitely a BCG, or the first dose of diphtheria tetanus would have been followed and received for every child in this country or anywhere in this world. But still, there are zero doses in India. 63% of children living in the 5 major states in this country, Bihar, Madhya Pradesh, Maharashtra, Rajasthan, and Uttar Pradesh, are still on the zero dose in this country, where they have not received even a single vaccination since their birth. The same is applicable for certain northeastern states. 17% in Meghalaya, 15% in Nagaland, 14% in Mizoram, and 13% in Arunachal Pradesh. But this was a very high statistics in the late 20th, 21st century. But because of the multiple rounds of intensified mission by Indramushal, IMI, which aimed at bridging the immunization gap in certain selected districts because of the prevalence of epidemic and pandemic, that the government has launched such program, and that is why the zero dose in India is gradually coming down, but still we are still a long way to reach to conquer the zero dose in our country. And how can this be done? We will have to see it. Everybody in this decade will know COVID, the vaccination, and how the world survived the COVID, and how people crumbled to COVID. People who have scrambled were not fortunate to have received the vaccination. If the country is back again, if the world is back again doing its normal activity within a span of 1 to 1.5 years, or in fact 2 years, is because of the COVID vaccination. It's not only because of the eradication or the limiting the COVID-19 virus from being spread, it's because of the vaccination. 220 crores of vaccination has been administered in this country. 98% of the adults have received at least one dose of COVID vaccination, and 90% have been fully vaccinated. 8% is a gap in between. People who feel that they are fine, good, they don't need a vaccination, or people who are afraid that few people had some complications because of the vaccination, who have not taken, and that is only 8% of the Indian population. Thanks to the effort taken by the government, thanks to the effort taken by so many public known figures, popular figures, that COVID could be stalled and then almost eradicated from India. What does vaccine contains? It contains an antigen, which is a weakened or inactivated part of the germ or the bacteria, which is introduced into the system intramuscularly or subcutaneously based on the efficacy of the medicine to act wherever it is. And it triggers an immune response from the host without actually causing the disease. But this antigen given always does cause a reaction fever. And that is one of the controversies and one of the myths that prevent the people taking in the vaccine, though advocated in a large extent in our country, in spite of a huge and varied population and a landscape. The adjuvant in the vaccine helps to boost the body's immunity response to the vaccine. The preservatives ensure the vaccine remain effective after being manufactured. It is mostly a protein which are made in an inactivated form, and these have to be kept along with the preservative so that the vaccine remains effective all through its storage. And most of the vaccines have a very short life. Stabilizations helps maintain the vaccine effectively during storage because it has to be transferred from one place of manufacturing all over the country. And this country is a vast country, and transportation and logistics are the one which needs to be taken care in a shortest duration of time while transmitting the vaccine so that it doesn't lose its potency on its transfer. There is Humpty number of reasons for vaccine hesitancy. The fear of side effects. Many people believe that vaccine causes serious side effects, impotence, or even death. During the COVID, we have seen a few people dying after the vaccine. All of a sudden, there have been deaths which has been reported. But in whole, in this country, post-vaccine death, I don't say related to COVID, post-vaccine death in the entire country in the last 75 odd years had been around 70,000 deaths. That is what's been reported in the Wikipedia. And in that such a huge population, 70,000 it means is a very small percentage. And people fearing because of the side effects, it doesn't really carry the value. People know, people have seen how polio have changed the quality of life. It was only a oral drop that was took up well with the population. As long as something is not being poked into the individual and being given orally, oral pumps in oral polio was a very big success. The success continued later also, even after there had been a very few meager reports in single and double diseases in this country. The government went on trying to give booster doses for children below 5 years of age, even up to the last 2 3 years, until the last 2 years, even after the COVID also, because it was targeting the population which can be exposed to the infection, and conquering polio had made people walk around comfortably without any handicap. Today, if they are going to give a disability certificate for a polio victim, I think the fault will lie on the individual and not on the population, or not on the bureaucrats, because to prevent polio and to conquer polio, the government have taken a very, very big efforts. Lack of trust. They doubt about the efficacy of the vaccine or think they are unnecessary. That is because people always have a confidence. The 8% difference between the totally vaccinated and first single dose vaccinated in COVID is what is called the lack of trust, or you have to say overconfidence of the individual that these things will not affect them. But that is not true. Anytime anybody's host immunity can come down, and anytime the virulence of the organism can transfer, mutate, become bigger and stronger, that they can get infected, even if they have taken half the dose, half the regime of vaccinations. The efficacy of vaccine cannot be doubted. There has been controversies about COVID in the last 2 3 years, but still people have survived. People are living. Whoever have taken COVID have survived, have passed through the whole stage of the disease, and now they are living around happily and now commenting about what is happening around in the world. And we need to have the trust when scientists have produced something, and before these vaccines come into the society, so much of trial has been conducted and it has been foolproof, and no government will ever take the risk of trying to risk their population. Misinformation, rumors about vaccine disrupting menstruation cycle or reducing fertility have contributed to the fear and hesitancy. That's it not only gives that misinformation. People are unable to work. Hard labor, they keep saying, unable to work for a day or two, but then they carry on that 1 or 2 days of fever, which is a reaction fever, for weeks together, when they have their own thought block that they are struggling. The hard labor depends on their muscle and bone to survive every day. And if they are unable to work, that misinformation is carried on to the whole of the rural area, and that population is unwilling to take the vaccination. Religious and cultural beliefs have always been overcome, trying to prove it in the necessary forum that the vaccines have been effective and effectively for the populations. And these cultural beliefs and religious beliefs should always be overcome, trying to use the head of their population, their sector, and winning them over to take up the vaccine in a big way. Challenges in vaccination is accessibility. This is a vast country. Manufacturing happens at one point in the country. Usually it is around the central part of India, somewhere in Maharashtra or Gujarat, or somewhere in that region, and reaching from that sector to the northeastern area is always had been a challenging task. But then accessibility of not only the vaccine reaching that place, but in a rural population, the populations, the primary health centers are several thousands in this country. But then, however you plan, there will be areas that will not be covered up easily. But today, there are mobile vaccines available by the country for the populations, and that accessibility has made it much, much easier and simpler. But accessibility still continues to be a problem of challenges in this country, because the country is vast. The population would have gone for their daily labor work. They might be missing in the morning. For these things only, government had come forward and things to do even on a holiday, that's on a Sunday. But hard labor working in the farm doesn't know the weekdays. All days are their working days. But then we have to take effort, and there is something which we need to do that also. Data quality, ensuring accurate and reliable data on vaccine rates and outcome. The biggest difficulty in this country is data entry. People talk, take pride in telling everything, but they are poor in documenting. And today, documentation is not writing, it is only typing on your mobile, typing on your laptops or on your desktops, typing so that the data reaches in an appropriate place. How many times have you taken time and effort to Google or to Bing a positive response wherever you got, wherever you have experienced. It's a responsibility of an individual to give the appropriate data to the country so that the challenges of vaccination can be overcome there. Addressing misinformation, today information is on a humpty number of social media platforms. There has been no censors on that. Censure has to be there when they are trying to give wrong information. Today we have popular stars from the film industry, from the sports quota, from the political side, from the popular figure, trying to dispel the misinformation about anything that happens in society, very particularly on vaccination. And we know that the companies which are manufacturing the vaccinations have now come forward trying to dispel the wrong information in the society, which has to be promoted and projected in the social media by every responsible citizens. When COVID vaccine came, people were afraid that if we are going to administer the vaccine as a healthcare worker, you might get infected. But that is not the status. When somebody is producing a vaccine, the people who produce are also people who are exposed to the infection. But they do have a double precaution, a triple precaution. The same thing is applicable to the healthcare workers, that they have to be trained, treated, coached, and given all the safety guards to provide and to combat the challenges that the health workers have in their mind, that giving vaccination could also infect them. But that is not the case, that providing vaccination by them is going to help the society and take the country forward also. That's a pride that they will have to do. The pro-vaccine campaign, I think that's now done by the stars in the country plus the company that are producing, and that is how we are now combating the social media's problem. There are traditional problem that people don't take vaccine in the society. Today, there are umpteen number of people living in the mountains and in the valley who had not been exposed to the medical management are now being given vaccination by the authorities, reaching them through the mobile. And that initiative is the one which has made the coverage of COVID vaccination, has made the coverage for the neonates and children of the society. Improving accessibility, there are door-to-door campaign vaccine drives with the mobile health team everywhere, and that's a boon and a boost for the country's population, and that is where the GDP's expense has to be there by the country. When you have a strong population, you will have a strong economics, and there will be a workforce to do the work in this country. Promoting frontline workers, I think there are people who can take forward the canvassing. There are people in the healthcare sector who try to educate the population. Somebody who is an healthcare worker who can go around the residents around him and tell them and prove to them, show to them the effects of this vaccine, the people how they have survived. Very, very simple was the oral polio vaccination. And if anybody had suffered tetanus in their family for not having taken a single small dose of injection, then they will know, they will go about propagating how tetanus is bad, how difficult it is to come around of tetanus once you are infected, and how easy and how it is most economical and most easiest way to come out of a tetanus, having an appropriate injection at the appropriate day of the injury. And today, tetanus is not like before, once in a year. There are a lot of scopes and a lot of protocols which have changed for tetanus injection. And today, most of the hospitals don't have a separate tetanus ward. Conquering tetanus or combating tetanus has been a very, very easiest job for the healthcare workers. Facilitating transportation charges, investing in digital infrastructure and data analysis to enhance vaccine efforts. If you say your entire population, people living around you, 90% have been vaccinated, then the rest of the 10% will come forward. And that information will have to be dispelled or physically by people, health workers going around telling your neighbor has been infected. In case somebody gets infected in this area, it might be because of you. You might be taken to charges by morally by the population. This is the way that the frontline workers and transformation of information that most of the population in the area has taken the injection will help in initiating the overcoming the challenges that is there. I think with all this information, the way how the challenges where we have the how the initiative can be taken. It's not only on the part of the government, but also every individual, whoever has taken the vaccine, whoever has combated the infection seen in the family, are the brand ambassadors of vaccination. If 28 diseases, if 28 viruses or bacteria can be conquered in this country, in the world, I think it is a responsibility of every individual to take forward and tell the population how vaccination has helped them, how vaccination will help them also to combat any infection in the society. Combating the infection, which is easy, can also be there. The public health is only two things. One is proper water, sanitation, disposal of waste, and vaccination. The other three sectors depends on what is being provided by the government of good water, sanitation, and keeping yourself clean and neat, your hand washing and everything. That's a different aspect which doesn't involve medication or vaccination. The other one is vaccination, and that is how even the regular epidemic of cholera has overcome, has been combated, has been removed away in a society because of cholera injection being given in pandemic and endemic area for years together. And today it's hardly been seen. Getting a cholera infection, trying to get hospitalized, though we have good medicines right now, why should we suffer that manpower of 5 days to 10 days? And that is why vaccine is very, very useful. Even if a reaction for the fever is there, it's hardly going to be for 6 to 12 hours. The man hours is not lost. The physical inability of the man is also not lost. And vaccine are the one that can help the society to combat any infection. And when and the science is going to grow to such an extent that there will be a day when non-communicable disease like diabetes are also may be conquered with the vaccination. There are ways when they are trying to combat the non-communicable disease, but there will be a day when vaccine also will be there to combat, to fight the non-communicable diseases. A nation immunization awareness is very much, and that is why today IJCP has taken this effort of trying to educate the medical community on the value of vaccination and how we have to fight the myths and the rumors that are there in the society, so that we take forward a healthy society and a positive economic status in this country. Thank you for the opportunity. Willing to take up any questions if they are there.
Thank you, sir. Thank you so much for your wonderful insight into the topic. Moving on to the questions, sir. Shall we take the questions now?
Yeah, yeah, please.
So let us see what are the questions. So the first question is, in your experience, how do socio-economic factors and access to healthcare influence vaccination rate in communities, and what strategies can be implemented to improve the coverage?
Socioeconomics is not a problem nowadays. Vaccines are available in almost all the government hospitals and sector. What I was talking about rabies was is the one which is a costly vaccine as far as the common public is there. But today, every vaccine is available in all the government hospitals, in all the central government institution, and most of the time, it is being administered free of cost. That's a national policy, and so socio-economic issue is not there. It is only people reaching the place where the vaccines are available. That is where the whole problem is in this country. Accessibility to the vaccines place where they are available.
Right, sir. Right. Um, Sir, what are the major challenges faced by healthcare providers when dealing with patients who refuse or delay vaccination for their children?
That's a problem everywhere. The parents will be busy or would have forgotten. That's the reason why it is. And when they come late, they have to reschedule their vaccination. Reschedule the vaccination should be educated to the population. That's another big challenge, because they might come after the period when the vaccines are in the process of producing immunity, but then the booster dose is not given, it is not really going to be effective. When they are missing certain vaccines at the scheduled time, and how long they can continue, or how later they have to restart again, that's the first challenge that is there, to educate the medical community or the healthcare workers, because most of the time the healthcare workers are the one who are there. We need to educate them, everybody. Today, digital technology is available. India is a country which has the largest number of mobile users. I think information technology, data entry will have to be there. You are today trying to follow the patients who don't come to you for a follow-up vaccine are to be called. There are times when this system was used in the postal department, and they try to give a letter or send it. You wait for 5 6 days, then sends a postcard that reaches them after 48 hours, and then they try to reschedule them and come. Today, digital technology is there. We need to use that information technology and spread the and invite them on the digital mode to come and take the vaccine for the children, because rescheduling is going to take more that time, cost at times. So following it appropriately, if the schedule is on Tuesday of this month, the first Tuesday of this month, I think at least two earlier information can be given to combat these challenges. If it is going to be on Tuesday, then one something on a Sunday, and then previous Tuesday or a previous Thursday. Just to keep telling people, you can always forget things that are due for yourself. And it is a responsibility of the administrators that we need to follow these people and get it done appropriately for the country's sake.
Right, so very important point that you have like highlighted. So moving on to the next question. Sir, this is regarding adult vaccinations, especially with new vaccines emerging for diseases like COVID-19, influenza, and shingles. So, what is your viewpoint on that, sir, on adult
Uh,
immunization?
there was a infectious disease consultant who told some 6 7 years ago, if you don't take the influenza vaccine, if you don't take a pneumococcal vaccine, you're going to die. It's true. Today, with non-communicable disease to a large extent, and people with 60 plus or 70 plus, they scramble post infection due to these viruses. You have an yearly vaccination for an influenza. They know once the monsoon sets in, the viruses are there infecting everybody. They know the monsoon season is the most auspicious days in this country, where you go to the temple, where you go to the festival, where you go for a marriages or something happens around you. And if you are going around with 60 plus, with all the comorbids, and if you don't take these vaccines, that is where you started scrambling. You have a fever that drops down your immunity, then your COVID try to conquer you, and you get a secondary infection, all the problem starts. Just because you have not taken an influenza vaccine, you are in a crowded place. And it is true that gentleman infectious disease consultant who told 6 years or 5 7 years back was almost laughed out. But today, most of the ICUs receive patients who are not being vaccinated yearly influenza or the pneumococcal once they had been hospitalized for any of their comorbid ailments. People who have had it had never had an infectious disease in their life. That's the statistics which is going to be provided in this country in a due course of time. That people who had been vaccinated are not going to scramble to the infectious disease. That is going to come, and that is going to encourage the population to take up the adult vaccination. Of course, adult vaccination has not taken to the way the pediatric vaccine, but then it is now in the process. Every infectious disease consultant, every physician or a cardiologist or a diabetologist are now advising their patients to take the yearly influenza vaccine, which has come in a big way. Thank you.
Right, sir. Thank you so much, sir. So let me see if there are any more questions, or else we would like to conclude the session for today. Sir, no, there are no more queries. So, sir, thank you, sir. Thank you so much for
Thank you.
answering all the
Thank
queries
you.
that the audiences have. And I would like to thank all the audiences for joining in and for this very engaging session. Thank you so much, sir, once again for your insightful presentation and for putting in a lot more effort into the session. Thank you so much, sir.
Thank you for the wonderful opportunity. I have learned also all the vaccines and challenges and controversy. Thank you very much.
Our pleasure, sir. Thank you so much.
Welcome, welcome.